Imagine your body as a complex and finely tuned machine, much like a car. Every system working in harmony to keep you moving and functioning at its best. And in this intricate system, the thyroid gland acts as the engine's accelerator, controlling how quickly or slowly your body burns energy. It's a crucial component in regulating your metabolism. This small, butterfly-shaped gland, nestled at the base of your neck, plays a vital role in setting your metabolism's pace. It produces hormones that influence nearly every organ in your body. It sets your metabolism's pace, dictating how efficiently your body converts food into energy and how quickly your cells work. But what happens when the thyroid goes into overdrive? When it starts producing too many hormones, a condition known as hyperthyroidism, your body races out of control, like a car with its accelerator stuck to the floor. Everything speeds up, often to an uncomfortable and even dangerous degree. You might feel your heart pounding rapidly, experiencing palpitations that can be quite alarming, your hands shaking, a tremor that makes everyday tasks difficult. And you might lose weight without even trying, despite possibly eating more than usual. Even at rest, you're sweaty, feeling overheated and uncomfortable, regardless of the temperature around you. You feel anxious, on edge, and irritable, struggling to manage your emotions. And despite the racing energy, you're constantly exhausted, drained of vitality. It's as if you've run a marathon standing still, expending enormous energy without any physical activity. Sleep becomes nearly impossible, as your mind and body remain in a state of hyperarousal, and your mind races with worry, filled with intrusive thoughts and anxieties that you can't seem to control. These symptoms aren't just stress or everyday anxieties, they're a sign that something deeper might be amiss. They're your body's alarm bells, signaling that your thyroid is working in overdrive and needs attention. Left unchecked, hyperthyroidism can damage your heart, leading to arrhythmias and other cardiovascular problems, and weaken your bones, increasing the risk of osteoporosis. But there's hope. Hyperthyroidism is a manageable condition. With the right diagnosis, often involving blood tests to check your thyroid hormone levels and appropriate treatment, you can regain control of your health and well-being. Don't ignore the signs. Early detection is key to preventing long-term complications. Talk to your doctor if you notice these changes in your body. They can assess your symptoms and determine if further investigation is needed. Hyperthyroidism is treatable through medication, radioiodine therapy, or in some cases, surgery. And early action makes all the difference in minimizing the impact on your overall health and quality of life. Listen to your body. Pay attention to the subtle cues it's giving you. It's telling you something important about your health and well-being, and it's crucial to listen and respond accordingly. The most common cause of hyperthyroidism is Graves' disease and autoimmune mix-up. Here, your immune system mistakenly attacks your thyroid, flooding your body with hormones. These antibodies, called TSIs, keep the thyroid stuck in overdrive. The result? A swollen gland, rapid heartbeat, and a body running on high alert. Graves isn't your fault, it's a complex mix of genetics and environment. Triggers like stress or infection can set it off if you're predisposed. Understanding this helps you realize your thyroid is just following faulty instructions. With the right treatment, you can block these signals and restore balance. Remember, Graves' disease is manageable with medical help. Graves' disease is a well-known culprit, but it's important to remember it isn't the only cause of an overactive thyroid. There are several other factors that can lead to this condition, and understanding them is key to proper diagnosis and treatment of an overactive thyroid. It's a complex issue with various potential origins. Sometimes thyroid nodules, which are essentially lumps in the gland, can become problematic. In some cases, these nodules start producing thyroid hormones completely on their own, independent of the body's regulatory system. This condition is called toxic nodular goiter, also known as plumber's disease, and it represents a significant portion of hyperthyroidism cases. It's more common in older adults, often developing gradually over time. The symptoms might be subtle at first, making early detection crucial. Another cause is thyroiditis, which refers to inflammation of the thyroid gland. This inflammation, often triggered by a viral infection, can cause a temporary surge in thyroid hormone levels, leading to hyperthyroidism. The effects are usually temporary but can still be quite impactful. Even excessive iodine intake, whether from supplements or certain medications, can sometimes trigger hyperthyroidism in susceptible individuals. This is because iodine is a key component in thyroid hormone production, and too much of it can overstimulate the gland. Each of these causes requires its own specific treatment approach, so accurately pinpointing the underlying source of the hyperthyroidism is absolutely crucial for effective management. The development of symptoms can vary significantly, appearing slowly and subtly in some cases, or emerging quite suddenly and dramatically in others, depending on the specific trigger. Given this variability, a thorough evaluation by a qualified doctor is absolutely essential to ensure you receive the proper diagnosis and the most appropriate care plan tailored to your individual needs. It's important to avoid self-diagnosing based on online information. If you notice any symptoms that concern you, it's always best to consult with a healthcare professional and get tested to determine the cause. Accurately identifying the underlying cause of your hyperthyroidism is the critical first step on the path to receiving effective and personalized treatment that addresses your specific condition. Anyone can develop hyperthyroidism, but some are at higher risk. Women, especially between ages 20 and 40, are much more likely to be affected. Family history matters. If thyroid disease runs in your family, your risk increases. Older adults are more prone to nodular thyroid problems. Smoking is a major risk factor, especially for Graves' disease and its eye complications. Stress, recent childbirth, or viral infections can also play a role. Knowing your risk factors helps you catch symptoms early. Share your family history with your doctor and stay alert to changes. Early awareness leads to better outcomes. Be proactive, your health is in your hands. While you can't always prevent hyperthyroidism, lifestyle choices matter. Managing stress is key. Try yoga, meditation, or time in nature to calm your system. Eat a balanced diet to support your body's increased needs during hyperthyroidism. Limit caffeine and sugar if they worsen your symptoms. Quitting smoking is crucial, especially to protect your eyes. Regular checkups and early testing are vital if you have risk factors. These steps empower you to manage symptoms and support treatment. Take charge of your health. Small changes make a big difference. Hyperthyroidism, an overactive thyroid, can significantly impact your well-being. Fortunately, it is highly treatable with modern medicine. The first line of treatment is usually antithyroid drugs. These medications are designed to help regulate the thyroid gland's activity. They work by directly interfering with the thyroid's ability to produce hormones, effectively slowing hormone production and bringing levels back to normal. Beta blockers may be added to the treatment plan. While they don't directly affect the thyroid, beta blockers can quickly ease symptoms like a racing heart, anxiety, and tremors, providing much-needed relief. For a lasting solution that addresses the root cause, radioactive iodine therapy is often used. This treatment involves taking radioactive iodine, which is absorbed by the thyroid gland, working to shrink the overactive gland and reduce hormone production. Surgery, removing part or all of the thyroid, is also a viable treatment option. This surgical intervention is another option, especially for large goitres or in cases where there are suspicious nodules that need to be examined. Surgery might be recommended if other treatments aren't suitable or if there are specific concerns about the thyroid structure. After surgery or radioactive iodine treatment, it's common to experience a decrease in thyroid hormone production. Because of this, you'll likely need daily thyroid hormone replacement to maintain optimal hormone levels and overall health. Your doctor will carefully tailor treatment to your individual needs, considering factors like your age, overall health, and the severity of your hyperthyroidism. Regular follow-up appointments and blood tests are essential to monitor your progress and adjust the treatment plan as needed. With consistent treatment and monitoring, most people experience significant improvement and feel better within weeks to months. Don't delay seeking medical attention. Effective treatment can restore your energy levels, improve your overall health, and enhance your quality of life. With the right care and management, you can successfully manage hyperthyroidism and live a full, active, and healthy life. Graves' disease can affect your eyes, causing dryness, swelling, or even vision problems. Not everyone gets eye symptoms, but if you do, early care is vital. Smoking greatly increases the risk and severity of eye disease. Quitting is the best protection. Use lubricating drops, wear sunglasses, and sleep with your head elevated to ease discomfort. Regular eye checkups are essential if you have Graves' disease. With prompt treatment, most people manage symptoms and protect their vision. Stay alert to changes and work closely with your healthcare team. Modern treatments offer real hope for recovery and a healthy future. Listen to your body, seek help early, and look ahead with confidence.